Comprehensive NCLEX RN Practice Exam 14-2026. Question 1. A patient in the cardiac unit is concerned about the risk factors associated with atherosclerosis. Which of the following are hereditary risk factors for developing atherosclerosis? A. Family history of heart disease. B. Overweight. C. Smoking. D. Age. Heredity, family history, age, and gender are non-modifiable risk factors. Smoking and obesity are modifiable lifestyle factors. Question 2. Claudication is a well-known effect of peripheral vascular disease. Which of the following facts about claudication is correct? Select all that apply. A. It results when oxygen demand is greater than oxygen supply. B. It is characterized by pain that often occurs during rest. C. It is a result of tissue hypoxia. D. It is characterized by cramping and weakness. Claudication is ischemic muscle pain triggered by activity and relieved by rest. Pain during rest, option B, indicates a more advanced stage of PVD. Question 3. A nurse is providing discharge information to a patient with peripheral vascular disease. Which of the following information should be included in the instructions? A. Walk barefoot whenever possible. B. Use a heating pad to keep feet warm. C. Avoid crossing the legs. D. Use antibacterial ointment to treat skin lesions at risk of infection. Crossing the legs compresses the arteries and veins, further impairing circulation in a patient with PVD. Barefoot walking and heating pads are avoided due to risk of injury/burns. Question 4. A patient who has been diagnosed with the vasospastic disorder, Raynaud's disease, complains of cold and stiffness in the fingers. Which of the following descriptions is most likely to fit the patient? A. An adolescent male. B. An elderly woman. C. A young woman. D. An elderly man. Raynaud's disease primarily affects young women, typically between ages 15 and 40. Question 5. A 23-year-old patient in the 27th week of pregnancy has been hospitalized on complete bed rest for 6 days. She experiences sudden shortness of breath, accompanied by chest pain. Which of the following conditions is the most likely cause of her symptoms? A. Myocardial infarction due to a history of atherosclerosis. B. Pulmonary embolism due to deep vein thrombosis, DVT. C. Anxiety attacks due to worries about her baby's health. D. Congestive heart failure due to fluid overload. The combination of pregnancy, hypercoagulable state, and prolonged bed rest, venous stasis, significantly increases the risk for DVT and subsequent pulmonary embolism. Question 6. Thrombolytic therapy is frequently used in the treatment of suspected stroke. Which of the following is a significant complication associated with thrombolytic therapy? A. Air embolus. B. Cerebral hemorrhage. C. Expansion of the clot. D. A resolution of the clot. Thrombolytics, clot busters, work systemically. The most dangerous adverse effect is intracranial hemorrhage. Question 7. An infant is brought to the clinic by his mother, who has noticed that he holds his head in an unusual position and always faces to one side. Which of the following is the most likely explanation? A. Torticollis, with shortening of the sternocleidomastoid muscle. B. Craniosynostosis, with premature closure of the cranial sutures. C. Plagiocephaly, with flattening of one side of the head. D. Hydrocephalus, with increased head size. Torticollis, Rhineck, is characterized by a persistent head tilt toward the affected side with the chin rotated to the opposite side, caused by shortening of the SCM muscle. Question 8. An adolescent brings a physician's note to school stating that he is not to participate in sports due to a diagnosis of Osgood-Schlatter disease. Which of the following statements about the disease is correct? A. The condition was caused by the student's competitive swimming schedule. B. The student will most likely require surgical intervention. C. The student experiences pain in the inferior aspect of the knee. D. The student is trying to avoid participation in physical education. Osgood-Schlatter is an overuse injury causing inflammation of the area just below the knee where the patellar tendon attaches to the tibia, tibial tubercle. Question 9. The clinic nurse asks a 13-year-old female to bend forward at the waist with arms hanging freely. Which of the following assessments is the nurse most likely conducting? A. Spinal flexibility. B. Leg length disparity. C. Hypostatic blood pressure. D. Scoliosis. This is the Adams forward bend test, the standard screening used to detect scoliosis in adolescents. Question 10. A clinic nurse interviews a parent who is suspected of abusing her child. Which of the following characteristics is the nurse least likely to find in an abusing parent? A. Low self-esteem. B. Unemployment. C. Self-blame for the injury to the child. D. Single status. Abusing parents often exhibit low self-esteem and are under stress, unemployment/single parenthood, but they rarely take responsibility or show self-blame, usually blaming the child instead. Question 11. A nurse is assigned to the pediatric rheumatology clinic and is assessing a child who has just been diagnosed with juvenile idiopathic arthritis. Which of the following statements about the disease is most accurate? A. The child has a poor chance of recovery without joint deformity. B. Most children progress to adult rheumatoid arthritis. C. Nonsteroidal anti-inflammatory drugs are the first choice in treatment. D. Physical activity should be minimized. NSAIDs, like naproxen or ibuprofen, are the first-line pharmacologic treatment for GA to reduce inflammation and pain. Question 12. A child is admitted to the hospital several days after stepping on a sharp object. The physician is concerned about osteomyelitis and has ordered parenteral antibiotics. Which of the following actions is done immediately before the antibiotic is started? A. The admission orders are written. B. A blood culture is drawn. C. A complete blood count with differential is drawn. D. The parents arrive. Cultures must always be obtained before the first dose of antibiotics is administered to ensure the growth of the causative organism is not suppressed. Question 13. A 2-year-old child has sustained an injury to the leg and refuses to walk. The nurse documents swelling of the lower affected leg. Which of the following does the nurse suspect is the cause of the child's symptoms? A. Possible fracture of the tibia. B. Bruising of the gastrocnemius muscle. C. Possible fracture of the radius. D. No anatomic injury. The child wants his mother to carry him. In toddlers, a common injury is a toddler's fracture, which is a non-displaced spiral fracture of the tibia caused by twisting. Question 14. A toddler has recently been diagnosed with cerebral palsy. Which of the following information should the nurse provide to the parents? Select all that apply. A. Irregular developmental screening is important to avoid secondary developmental delays. B. Cerebral palsy is caused by injury to the upper motor neurons and results in motor dysfunction, as well as possible ocular and speech difficulties. C. Developmental milestones may be slightly delayed but usually will require no additional intervention. D. Parent support groups are helpful for sharing strategies and managing healthcare issues. Cerebral palsy is a permanent, non-progressive motor disorder. Management requires multidisciplinary intervention. Option C is incorrect as it implies no intervention is needed. Question 15. A child has recently been diagnosed with Duchenne muscular dystrophy, DMD. Which of the following statements includes the most accurate information? A. Duchenne's is an X-linked recessive disorder, so daughters have a 50% chance of being carriers and sons a 50% chance of developing the disease. B. Duchenne's is an X-linked recessive disorder, so both daughters and sons have a 50% chance of developing the disease. C. Each child has a 1 in 4, 25%, chance of developing the disorder. D. Sons only have a 1 in 4, 25%, chance of developing the disorder. DMD is X-linked recessive. If the mother is a carrier, there is a 50% chance for sons to have the disease and a 50% chance for daughters to be carriers. Question 16. A client is scheduled for a percutaneous transluminal coronary angioplasty, PTCA. The nurse knows that a PTCA is the A. Surgical repair of a diseased coronary artery. B. Placement of an automatic internal cardiac defibrillator. C. Procedure that compresses plaque against the wall of the diseased coronary artery to improve blood flow. D. Non-invasive radiographic examination of the heart. PTCA involves inflating a balloon within the artery to compress plaque and widen the lumen, restoring blood flow. Question 17. A newborn has been diagnosed with hypothyroidism. In discussing the condition and treatment with the family, the nurse should emphasize: A. They can expect the child will be mentally retarded. B. The administration of thyroid hormone will prevent problems. C. This rare problem is always hereditary. D. Of physical growth/development will be delayed. Early diagnosis and immediate, lifelong thyroid hormone replacement, levothyroxine, allow for normal physical and mental development. Question 18. A priority goal of involuntary hospitalization of the severely mentally ill client is: A. Reorientation to reality. B. Elimination of symptoms. C. Protection from harm to self or others. D. Return to independent functioning. The legal and clinical basis for involuntary hospitalization is the immediate need to prevent harm to the patient or others. Question 19. A 19-year-old client is paralyzed in a car accident. Which statement used by the client would indicate to the nurse that the client was using the mechanism of suppression? A. I don't remember anything about what happened to me. B. I'd rather not talk about it right now. C. It's the other entire guy's fault. He was going too fast. D. My mother is heartbroken about this. Suppression is the conscious decision to put an unsettling thought or feeling out of one's mind until a later time. Question 20. The nurse is caring for a woman 2 hours after a vaginal delivery. Documentation indicates that the membranes were ruptured for 36 hours prior to delivery. What are the priority nursing diagnoses at this time? A. Altered tissue perfusion. B. Risk for fluid volume deficit. C. High risk for hemorrhage. D. Risk for infection. Prolonged rupture of membranes, over 18 to 24 hours, is the primary risk factor for maternal and neonatal infection. Question 21. A 3-year-old had a hip spica cast applied 2 hours ago. In order to facilitate drying, the nurse should: A. Expose the cast to air and turn the child frequently. B. Use a heat lamp to reduce the drying time. C. Handle the cast with the abductor bar. D. Turn the child as little as possible. Casts should be exposed to air to dry. Frequent turning ensures even drying and prevents skin breakdown. Never use heat lamps or lift by the abductor bar. Question 22. A client is scheduled for an intravenous pyelogram, IVP. In order to prepare the client for this test, the nurse would: A. Instruct the client to maintain a regular diet the day prior to the examination. B. Restrict the client's fluid intake 4 hours prior to the examination. C. Administer a laxative to the client the evening before the examination. D. Inform the client that only one X-ray of his abdomen is necessary. Laxatives/bowel prep are necessary to clear the colon of gas and stool, which could otherwise obscure the view of the kidneys, ureters, and bladder on the X-rays. Question 23. Following a diagnosis of acute glomerulonephritis, AGN, in their 6-year-old child, the parents remark, "We just don't know how he caught the disease." The nurse's response is based on an understanding that: A. AGN is a streptococcal infection that involves the kidney tubules. B. The disease is easily transmissible in schools and camps. C. The illness is usually associated with chronic respiratory infections. D. It is not caught but is a response to a previous B. hemolytic strep infection. AGN is an immune complex disease, not a direct infection of the kidney. It occurs about 10 to 21 days after a strep throat or skin infection. Question 24. A 6-month-old with diarrhea, vomiting and fever is on IV therapy. Which findings should be reported to the healthcare provider immediately? A. 3 episodes of vomiting in 1 hour. B. Periodic crying and irritability. C. Vigorous sucking on a pacifier. D. No measurable voiding in 4 hours. An absence of urine output, anuria/oliguria, in a dehydrated infant is a sign of worsening dehydration and potential renal failure, requiring immediate medical intervention. Question 25. While caring for the client during the first hour after delivery, the nurse determines that the uterus is boggy and there is vaginal bleeding. What should be the nurse's first action? A. Check vital signs. B. Massage the fundus. C. Offer a bedpan. D. Check for perineal lacerations. The first and most important action for a boggy uterus is fundal massage to stimulate contraction and stop uterine atony/hemorrhage. Question 26. The nurse is assessing an infant with developmental dysplasia of the hip. Which finding would the nurse anticipate? A. Unequal leg length. B. Limited adduction. C. Diminished femoral pulses. D. Symmetrical gluteal folds. Classic signs of DDH include unequal leg lengths, Galeazzi sign, asymmetrical skin folds in the gluteal/thigh area, and limited abduction. Question 27. To prevent a Valsalva maneuver in a client recovering from an acute myocardial infarction, the nurse would A. Assist the client to use the bedside commode. B. Administer stool softeners every day as ordered. C. Administer antidysrhythmics PRN as ordered. D. Maintain the client on strict bed rest. Stool softeners prevent the patient from straining, Valsalva, during bowel movements, which causes a sudden increase in intrathoracic pressure and heart rate. Question 28. On admission to the psychiatric unit, the client is trembling and appears fearful. The nurse's initial response should be to A. Give the client orientation materials and review the unit rules and regulations. B. Introduce him/her and accompany the client to the client's room. C. Take the client to the day room and introduce her to the other clients. D. Ask the nursing assistant to get the client's vital signs and complete the admission search. For a fearful/anxious patient, the nurse should provide a quiet, safe environment and establish a one-on-one rapport before overwhelming them with rules or groups. Question 29. During the admission assessment on a client with chronic bilateral glaucoma, which statement by the client would the nurse anticipate since it is associated with this problem? A. I have constant blurred vision. B. I can't see on my left side. C. I have to turn my head to see my room. D. I have specks floating in my eyes. Glaucoma causes a gradual loss of peripheral vision, tunnel vision. To see items not directly in front of them, the patient must physically turn their head. Question 30. A client with asthma has low-pitched wheezes present in the final half of exhalation. 1 hour later the client has high-pitched wheezes extending throughout exhalation. This change in assessment indicates A. Has increased airway obstruction. B. Has improved airway obstruction. C. Needs to be suctioned. D. Exhibits hyperventilation. The transition from low-pitched to high-pitched wheezing and the extension of the sound throughout the entire respiratory cycle indicates worsening airway narrowing/obstruction.